So what's my first step?
Review the patient's chart to identify the patient's medical problems, including whether the patient can sit or stand.
I'm reviewing the chart, and I see physical therapy has cleared this person for sitting, standing, ambulation, showers, etc.
Okay. Provides privacy by closing the room door and pulling the curtain.
Providing privacy.
Wash hands.
Hands washed.
Assess safety, fall precautions, alarms being used, swallowing precautions, contact airborne or respiratory precautions.
Scene is safe. She's got no band, says she's a fall risk. Oh, that's a fall risk. From the side.
Uses clean examination gloves if the patient has breaks in skin integrity.
I don't think the patient has any breaks, but I'll just be on the safe side.
Does eczema count?
Probably not.
Alright. Assesses the patient's vital signs first.
Okay. Vital signs. Okay.
Inquires whether the patient has any pain, nausea, or other discomfort. If has pain, then asks the location, quality, pain scale, score, and duration.
Okay, so tell me, do you have any pain right now?
Yes.
Okay, you do, and when did it start?
This morning.
Where exactly is the pain?
My sacrum.
Your sacrum, and has this been going on for a long time, or
Yes.
off and on for
A few months.
a few months
It's my
off and on?
Beginning my second trimester.
Is it constant all day or comes and goes?
It comes and goes.
Can you tell if it is relieved by anything like sitting down, standing, walking, moving?
Sitting down and when I pop my hip,
When you pop your hip, it helps. Does anything make it worse?
walking too much or standing too much.
Okay, all right, very good. On a scale of 1 to 10, where would you put that pain?
Maybe a 4.
4 right now?
Mhm.
And where would you put it when it's at its worst?
For a 5.
About a 5. Okay. Thank
And
you.
it's about like a sore.
It's kind of a sore kind of pain. Thank you for describing that.
Head and neck assesses level of consciousness, orientation to the four spheres in speech. Sorry.
All right. So can you tell me your name?
Alexi Fraser.
And can you tell me where you are?
I'm at Alamance Hospital.
And what day is it today?
It's Monday.
Who's the president of the United States?
Biden.
And can you tell me why you're here?
I'm here for a demonstration.
Right. And I can see that the patient is dressed appropriately for the weather and the situation. Her affect is normal. It's not blunt. It's not flat. I'm going to say that this person is alert and oriented ×4.
Okay. Assesses the pupils and pupillary shape in response to light and accommodations. Perla.
Pupil response to light. It's a word right here.
Yep.
All right.
There's also an app for that.
Oh, that's true. All right, so I'm just gonna look in your eyes. All right, I see the pupils constrict. So they're responding to light. They should also respond to light, even binocular, which they do. And they are round, they're equal, and let's see if they accommodate. I want you to stare at the end of my finger here and just keep your eyes on it. And as her eyes converge, the pupils constrict. So I would say Perla. I don't have to say she has Perla, I can just say Perla. Pupils equal, round, react to light and accommodate.
Assesses both the sclera and conjunctiva for color and moisture.
So sclera is white, conjunctiva is pink. There's no signs of edema or anemia.
He's about to take your eye out.
I'm a little heavy-handed at times. There's no signs of exophthalmos or arcocinilis or anything like that.
Yeah, I don't have contacts.
I got a question. Do you not have the bed raised?
Probably, yeah. For body mechanics, I should have it up. Good point. Good call. Okay.
Shall we kill our backs?
What's next? Yeah.
Okay. Inspects the face for symmetry and skin color. Notes affect and eye contact.
All right. The affect patient is normal. She doesn't seem emotionally labile. The face is symmetrical. There's no drooping. There's no flattening of the nasolabial fold. The skin color is appropriate for age, gender, and ethnicity.
Assesses the lips and oral mucous membranes for color, integrity, moisture, and lesions.
Mucous membranes are moist. Patient has good dentition, all of her own teeth. There's a little bit of dryness on the lips. Other than that, it's within
lips, y'all.
it's within normal limits.
Assesses the teeth and gums for dentures, missing teeth, decayed gum, recession, bleeding, sores, and lesions.
All right, I don't visualize any lesions. I don't see any missing teeth. The patient has had their wisdom teeth removed. The dentition is good. There's no halitosis. There's no food particles. If you stick your tongue out and say the soft palate moves up symmetrically. That's a measure of the vagus nerve 9 and 10. There's no redness, erythema, no coating on the tongue. Everything there is normal. Everything is normal there.
Okay. Assesses the neck veins for distension.
I see no jugular vein distension, either when sitting up like this or lying flat. If I laid the patient flat down, I might observe some jugular vein distension, which is a normal finding on a patient that's lying flat. And a jugular vein distension, I can see a little bit of a jugular vein pulsation, but it rises no higher than half of the jugular vein, which is a normal finding, which you don't know by now, but it indicates normal left-sided heart function.
All right. Assesses the carotid pulse on each side, not at the same time, noting strength and regularity.
So to assess the carotid pulse, I find the trachea, and I move just to the side of the trachea in that groove, and I find a strong bilateral palpable carotid pulse.
Okay. Inspects the chest for shape, symmetrical excursion, use of accessory respiratory muscles, and ease of breathing. Inspect symmetry with hands during inspiration.
I see no asymmetry. I see no accessory muscles being used, which we call accessory muscles would be like substernal retractions or intercostal muscles. And when the assessment is talking about looking for symmetry with breathing and placing my hands, it's talking about the respiratory respiratory excursion, where I'd put my hands on her back and I'd ask her to take a deep breath, and I see that my hands move symmetrically to the sides, such as that.
Assess the skin color, WDAO, pale, cyanotic, jaundice or flushed.
I see no jaundice, no flush. I see a good skin turgor. I see no evidence of poor circulation, including capillary refill is brisk. It's less than 3 seconds.
Assess the skin turgor.
Good.
Osculates the heart sounds in all 5 places, A, P, E, T, M, listening for S1 and S2.
I'm auscultating the heart at the aortic area, pulmonic, Erb's point, tricuspid, and mitral area, and I'm going to auscultate with both the bell and the diaphragm, so I can hear the difference between systolic and diastolic murmurs. I find no gallops, murmurs, or skips.
So it says osculate apical heart rate for a full minute, noting the rate, rhythm, and strength.
I'm going to auscultate the apical heart rate at the 5th intercostal space, mid-clavicular line, also known as the mitral place, and the point of maximal impulse for a full minute. And I can even compare that to the radial pulse to see if there's any kind of difference between the apical and the radial pulse.
Osculates the breath sounds listening anteriorly 8 to 10, posteriorly 10, and laterally 3. Isn't that supposed to be 4? Okay. Notes quality of sounds, adventitious sounds, and equally
I'm
of
auscultating.
left and right breath.
I'm auscultating the breath sound starting at the front, at the anterior. I can even auscultate the tracheal sounds, and then at the top of the apices of the lungs, I can listen for I can hear bronchovesicular sounds. Further out, I can hear bronchial, and then down at the bases, I might be able to hear vesicular sounds on the front, but more likely vesicular sounds on the back.
Do you want to review like stethoscope placement with a stethoscope?
What do you,
I was in the car.
Brittany, would you run to the lab and grab me a stethoscope out of the drawer that's underneath the computer cart?
So when you're doing 10 in the front, 10 in the back, and 4 on the side, right?
10 in the front, 10 in the back, 4 on the side.
Why does it say 3 on here?
At least 3.
Oh.
So on the front, just realize that your lungs are stacked like this, right? So on the front, you're probably only going to hear the upper and middle lobes. You're not really going to hear the lower lobes unless you listen to the posterior chest. What's next?
Okay. Inquires about cough, sputum production, or shortness of breath on exertion.
Have you had any cough?
No.
Have you had any shortness of breath?
When I walked very briskly, yeah.
About how far do you need to walk before you get short of breath?
It takes a little bit.
Would you say you could climb a flight of stairs without getting short of breath?
Yeah.
Sort of?
Yeah.
Okay, all right.
Okay. Oxygen devices, type and liters per minute, respiratory support devices, CPAP, about that.
None. There's no oxygen devices attached to the patient.
Inspects the abdomen for shape and size.
So we can describe this abdomen actually as flat because it's not, it's slightly protuberant, but it's still flat. The shape is round and it's appropriate for height and weight.
Auscultates for presence and activity level of bowel sounds in all 4 quadrants. Note for hyperactive, hypoactive, or absent bowel sounds.
I'm going to just assume that Brittany has not found a stethoscope. So where do I start? Do you remember where I start?
Lower left.
The lower
left.
Lower left?
I mean, it would be my left, but her right.
Right lower
Yeah.
quadrant. So I started, so we're cutting the stomach right in half along the navel. And we're listening.
There she is. She's come back.
Lower right quadrant.
Lower right quadrant is where we start. And I'm listening for the clicks, gurgles, pops, all of that good stuff. And what I'm expecting to hear is what?
Some activity.
Some activity. How much activity?
I mean, decent amount.
All right.
Not too fast, not too slow,
Not too
or
fast
not
and too
absent.
slow. So if I find that she has less than 5 vowel sounds per minute, I'm going to listen for a whole minute. If I find that she has greater than 30 vowel sounds per minute, I'm going to listen for a full minute. If I find that she has no vowel sounds, I'm going to listen for a lot longer time. I think it's like 5 minutes before I would ever document no vowel sounds. So the normal active abdominal sounds would be between 5 and 30. Less than 5 would be considered hypoactive. Greater than 30, hyperactive.
Palpates the abdomen for firmness and masses, noting if pain is elicited.
So you notice that I auscultated before I palpated. This is the only body system that we do that with. We always auscultate the bowel sounds first. Why is that? Because we don't want to increase activity.
Shake it up.
So I'm palpating lightly, and I'm asking the patient if they have any kind of pain anywhere.
Nope.
And I'm going to palpate in the suprapubic area and ask her if that gives her a sensation to void.
Little bit.
Little bit. All right. And although this is a pregnant female, we're not gonna do Leopold's maneuvers.
It's not yet. Not at 24 weeks.
All right, inquire regarding nausea, vomiting, indigestion, and discomfort.
Have you had any nausea, vomiting, indigestion, discomfort, diarrhea?
Nausea.
Nausea?
In the morning.
In the morning. So we call that, in medical terms, we call that hyperemesis gravidarum. It's normal, and it's because of a lot of times it's because of the hormones that have been dumped
But
into
I'm
your
not like
system.
throwing up.
Not a lot. That's good, because you could be at risk for dehydration. And what else could she be at risk of if she has excessive hyperemesis gravidarum?
Hypovolemia.
Yeah, hypovolemia. Any metabolic imbalances? Metabolic
Alkalosis.
Right. Metabolic alkalosis. Very good.
Okay. Inquires about the time of last voiding.
When's the last time you voided?
I voided roughly about an hour ago.
An hour ago?
or so.
Was there any smell to it? Was it clear? And was it painful?
No,
All right. How about your last bowel movement?
this morning.
How would you describe it? Was it solid, liquid?
Solid.
Solid, great. And do you usually have a bowel movement every day?
Yes.
Okay, great.
Okay, so that was 27 and 28.
Yep.
All right, inspects any tubes, NG tubes, G tubes, feeding tubes, equipment, or dressings of the chest and abdomen to ensure patency and proper function.
That's definitely something you want to do. Every time you go into a patient's room is the first thing you do is look at any tubes going in and coming out.
This is extremities. Palpates the radial pulses for strength bilaterally and
Which side?
equality of both sides.
Which side is the radial pulse?
Thumb side.
Thumb side. So I'm gonna assess the radial pulse, and I'm actually gonna do something a little different from maybe what you've learned. I'm gonna feel, because I can, assess the radial pulses bilaterally at the same time, because that can give me an indication of circulation, if one is stronger than the other, or if one's beat is different than the other.
Okay. Palpates hands for edema and warmth and assesses nail beds for color and capillary refill.
Nail bed's normal, there's no warmth. I'm gonna ask if there's any pain in this joint, in any of these joints. Good. I'm gonna ask you to squeeze my fingers, squeeze them tight, tight, tight. Good. I would say that her strength is equal bilateral.
Okay. Assesses range of motion of the arms and hands.
Right? Go ahead and raise your arms up. Raise them, pull them to the side. Put your arms across your chest and put them back down to your side. Any pain with that movement? Good. And she is able to move against gravity.
Assesses hand grips for bilateral equality. Oh, you did that one.
Done.
Inspects the lower legs and feet for color and signs of phlebitis.
Lower legs and feet for phlebitis. I can't see any phlebitis or swelling.
What is phlebitis?
Phlebitis is a inflammation of venous inflammation, basically. So there's no signs or symptoms of phlebitis or swelling. Legs are within normal limits.
That can be from too much sodium.
Sodium, it could be from pregnancy even.
Are those the varicose veins, or is that something else?
Varicose veins are actually called spider hemangioma.
Mm-hmm.
Phlebitis is slightly different. Phlebitis is an actual inflammation of larger veins, like the great saphenous vein, which travels the whole length.
Okay. Palpates the feet, ankles, and pretibial area for edema and skin texture.
So I'm checking also for my dorsalis pedis, my posterior tibia pulses. I can see that that there's full range of motion without pain or crepitus.
Palpates the pedal pulses for strength and equality. If unable to palpate the pedal pulse, will use Doppler and will assess for the femoral, popliteal, and posterior tibial pulses.
Every floor of the hospital, especially orthopedic floors, should have a Doppler ultrasound to check for pulse, because especially post surgery, every day as part of a shift assessment, Every nurse should be checking for the dorsalis pedis and posterior tibial pulse. And in fact, because it's checked so often, you'll often see on orthopedic floors that the nurses will actually take a little permanent marker and put an X right there on the dorsalis pedis.
I've done that in the ICU too, because some people are very hard to find.
And everybody's different. Some people's dorsalis pedis is gonna be up here, some are gonna be down here. Everybody's slightly different. So you don't wanna be searching around when you're in a hurry.
Right.
Okay, assesses for range of motion of lower legs.
Range of motion, she's able to flex her hips, she's able to flex her knees, she's able to do
Calves.
external rotation and internal rotation of the hips. Dorsiflex and plantar flex of both feet with no crepitus and no pain.
Assesses for strength and equality of.
Sorry?
You have to see all of that.
No, I'm being extra. If you just say I'm assessing range of motion of the feet, it doesn't matter if you remember that this is dorsiflex and this is plantar flex.
Okay, assesses for strength and equality of plantar and dorsal flexion of both feet.
So I'm assessing for strength, push down, good. And push up, good. Strength is 5 out of 5.
Assesses the posterior side of the body for any skin irregular, yeah, I know what I mean. For breakdown from head to heels.
During your physical
Irregularities.
assessment, it's really important to have the patient turn and do an assessment of their posterior chest to make sure that they don't have any skin breakdown. A lot of times in many units where, nothing against ICU nurses, but they're worried about them breathing and having a heart rate. They might not be paying that much attention to skin. So if you get an admission from the ICU, they could have a decube that had gone unnoticed for a while because they're just keeping their heart and brain alive.
Yep.
Irregularities, that's it, okay. I just wanted to get that.
No irregularities found.
Yep, okay. Inquires what assistive devices are used at home to ambulate.
Do you use a walker, a cane, or anything like that? Something over the toilet? Do you have a shower chair?
Reposition to a comfortable position.
This is comfortable.
Okay.
Call bell at side bed, lock, low position.
Here's your phone. Bed's locked, low position.
Documents the assessment findings in the patient's chart.
Documenting.
Compares current assessment with the previous assessment to determine whether the patient's condition is the same, improved, or deteriorated.
Compared.
Completes head to toe in a timely and an organized manner. Student is able to give a brief verbal report covering the main aspects of assessment.
It took me like 30 minutes